We've been reading scientific data on how alcohol affects your hormones and affects your body and speeds up the aging process for at least 20 to 30 years, and nobody's doing anything about it.
Welcome to the Myers Detox Podcast. I'm Dr. Wendy Myers, and on this show, we talk about everything related to heavy metal and chemical toxicity and the health issues caused by the toxins. And we also talk about anti-aging and bioenergetics and more advanced topics on health than you'll hear on other podcasts. And today we have Dr. Erika Schwartz on the show, and she's going to be talking about how alcohol disrupts hormones, sleep, and increases cancer risk. And so I haven't done a show on alcohol yet for some reason, but on the show, we're going to be talking about how no amount of alcohol is beneficial. There's way more downside than any perceived or potential benefits, and the newest research is showing that actually alcohol increases the risk of seven different types of cancer, including thyroid, tongue, liver, pancreas, colon, and ovarian cancer risk. And we also debunk the myth that one glass of wine is healthy. That used to be kind of the status quo. It's totally not true, probably funded by the alcohol industry. But really, what alcohol is doing is disrupting your hormone balance, disrupting your sleep, and your overall health. And we really go in deep on how alcohol affects your hormones, because Dr. Schwartz is a hormone expert. We also talk about how alcohol increases the prevalence of liver disease, obesity, diabetes, hypertension, arthritis, Alzheimer's, and other forms of dementia and cardiovascular disease. We talk about how alcohol lowers testosterone and all the other hormones in both men and women, including reducing thyroid function, leading to hypothyroidism. We talk about how alcohol depletes vitamins A, B, B1, 2, 3, and 6, K, zinc, and magnesium. Lower zinc means lower testosterone for you guys listening. And we also talk about how alcohol accelerates liver damage, which can lead to cirrhosis and liver failure. That liver performs 500 different functions. We don't want to be using up the liver's biological life with alcohol. We want that function to go towards detoxing the body, not detoxing alcohol. And we also talk about how alcohol disrupts sleep. A lot of people drinking alcohol to try to relax at the end of the day. It might make you pass out and relax, but because it raises your blood sugar and other mechanisms involved, it actually will spike your cortisol in the middle of the night, causing night wake ups. And you also get much reduced sleep. You get less deep sleep, less REM sleep when you're drinking alcohol. So pretty much anytime you're drinking alcohol, you are causing worse sleep, not better sleep. And also, if you're stressed or you have trouble sleeping, low progesterone is probably one of the main causes. So it's really important to test and replace progesterone beginning in your late 30s and 40s, not just when you're, thinking about that in menopause, like I did. And also if you drink, detox, it's taking a back seat. And so you also can't lose weight if you're drinking as well. So we go into all that fun stuff on the show today. And our guest today, Dr. Erika Schwartz, she's the founder of Evolved Science, a world-renowned medical practice based in New York City, built on the recognition that bioidentical hormones are the foundation of better health. And once hormones are balanced, the practice focuses on optimization and longevity through disease prevention, patient advocacy, and coordination of care. Dr. Erika is a pioneer in the use of bioidentical hormones for preventing illness and recognizing the direct link to overall wellness and their interconnection with diet, sleep, and stress management. Dr. Erika has authored 8 best-selling books, as well as numerous publications in the New York Times, Wall Street Journal, Daily Mail, Vogue, Town and Country, and the New York Post. And she appears frequently on TV shows, international podcasts, and social media, and she hosts the popular Redefining Medicine podcast. You can learn more about her work at eshealth.com. Dr. Schwartz, thank you so much for joining us on the show.
Wendy, thank you so much. It's a pleasure being on your show. I follow you, and I think everything you're doing is so good and so helpful, and women need a lot of help. It's about time. It's our time, actually. So
Yes, yeah, and I love doing shows like this to really help people to make some more distinctions and help them make better choices, especially when it comes to alcohol. And so there's a lot of confusing information out there about alcohol. But before we get to it, why don't you tell us a little bit about yourself and your practice and how you got into health?
Well, my training is in internal medicine and critical care, so I'm an MD. My first job was to run a major trauma center outside New York City when I was 28. And then I went into private practice about 5 years later and thought I wanted some contact, connection with the patients. And I stayed there for about 10 years and I realized I was totally wasting my time because as an internist, all I was expected to do was just either ping pong the patient out to a specialist or just do testing, waiting for something to go wrong. So I realized that that was not what I was there for because there was like a whole piece missing. And that piece was the moment between like when you're in acute care, I mean, running a trauma center, I knew what acute care is. Obviously, I know when you get run over by a truck, you do need conventional medicine. But once you're out of there and you're okay, there's a no one in the conventional system who knows that life is a continuum of health with small interruptions that should be disease. And the more time you spend educating, helping, treating people to stay healthy, the more successful you will be in caring for the patient.
Mhm.
So, having thought that through at the advanced stage of like 30 something, I decided to start learning about prevention, wellness. Hormones were just one of these things that came out. And it was very early because it was in the early 90s and there was no place to learn. And so this is how I got into being, I wrote books and I started educating people and people started coming to me and we still do the same thing. So hormones. So my first book that I wrote that was like a bestseller was like #2 on Amazon was about hormones. It was called The Hormone Solution. And it was right in the days when that study, the Women's Health Initiative, went bust. And everybody in the conventional world was very scared of hormones and said, oh, hormones are going to cause cancer, heart attacks, strokes, etc. And that was totally erroneous because it was wrong. And they took it back, but somehow the conventional world never understood that they took it back, that there was that the principal investigators of that study actually reported back on the reevaluation of the study, showing how hormones are actually great for you. There was no difference in all-cause mortality between women who had been on the hormones and women who weren't on hormones. They did not distinguish between the kind of hormones that women were taking. It was just a mess. And it's still a mess because to this day, the conventional world is not very clear on it. So I moved away from that. And now I teach at the American Academy of Anti-Aging Medicine, which is A4M. And I teach everywhere I can. And I come on podcasts like yours or anywhere I can to help women understand the options that we have and improve our lives.
Yeah, that's great because I know we're going to touch on hormone replacement therapy and what alcohol does to your hormones and all that. But yeah, it's really a pity that there are still so many women and men out there and doctors that think that hormones and hormone replacement is harmful in some way or causes cancer. And I've had a lot of friends that have recently consulted with doctors and they're trying to steer them away from hormone replacement. It's like, oh my God, I take hormone replacement and I should have done it 10 years earlier.
Right.
I wish I had started testing and replacing 10 years earlier because you might not need all the hormones, but a lot of women in their 40s, they need progesterone. They really do. But let's talk about alcohol. So before we get too distracted, because I can beat that horse for
Listen,
a long
it's not
time.
Listen, hormones are crucial, and I think that understanding, like what you just said, that the earlier you start, the better. The more you understand how your hormones work, the more likely you are to enjoy your life. And as you go through, everybody loves the labels, like, perimenopause, menopause, whatever you want to call it. I mean, I don't know why we don't talk about puberty because that's when it all starts. Um, what happens is that if your hormones are imbalanced, you feel great, you look great. Think about it. When you have a lot of hormones when you're fertile and you have babies, and they're not exactly killing you, they're keeping you healthy. They literally make you immortal. So if your hormones are imbalanced and you understand what the balance is for your own particular hormones, you'll do really well.
Yeah. So let's talk about something like alcohol that
Yeah.
throws off your hormones. And there's
Yeah.
so just let's just, because I know there's a lot of women out there that are having that glass of wine every night, or the guys are having their beers at the end of the day. And so let's just focus on women first. So what is that nightly glass of alcohol or that wine doing to your hormones?
Well, it's disrupting your hormone balance. What it's doing is it's changing your menstrual cycle. It changes the way your pituitary gland basically sends the messages. It actually affects every cell in your body negatively. And while we can get away with it in our 20s, we can get away with it in our 40s. And that's when actually you start drinking more, because that's when socially, you know, like you said, the guys are drinking, you're partying, and you don't realize that that's when you get into more trouble. And what happens is that your hormonal balance gets completely thrown off. I mean, we hear about, like recently, the Surgeon General had asked for black box warning for um, alcohol because it shows a increased risk of cancers, right? And it was like 7 cancers, not even 1 cancer, like 7, including ovarian cancer, colon cancer. And so that was one thing, but we've been reading scientific data on how alcohol affects your hormones and affects your body and speeds up the aging process for at least 20 to 30 years, and nobody's doing anything about it. And it's really interesting because, you know, Americans, it's our culture has become about drinking. And, during COVID, if you think about it, um, liquor stores were what
Selling out.
called yeah, yes, they were, essential businesses. The gym wasn't an essential business, but the local liquor store was essential businesses. It was just a horrible, horrible thing if you think about it, because it's all about money instead of being of what's good for each one of us. So alcohol in no form does it help. Now we know that we have a very high increase in liver problems, right? And, it's called steatosis, all of that because you're an ND, so But the thing is that that's really from all the alcohol we're drinking that's destroying our livers. And our livers are so important. That's where the hormones get processed, all the food we eat gets processed, the toxins from everything else we're taking and breathing, and everything gets processed. And unless you help detoxify, and getting rid of the alcohol is one way to detoxify, really important. It's a huge way. If you're not detoxified, you're not going to be able to make the correct hormones. You're not going to be in balance. And as you get older and need exogenous, hormones that come from the outside, you're not, your doctor or your whoever the provider is who's prescribing them for you will not be able to get the right combination for you if what you're doing is drinking. Now, the interesting thing is I see patients all the time. I'm in the office now, and new patients that I see sometimes will come in and say, just don't tell me not to drink. I love it. It's my relaxation. It's the one thing I could do for myself. And I say, listen, I'm not going to start by telling you that. You know how I feel because I tell everybody how I feel. But the point is, once you start feeling better, you'll have to stop. And you do stop on your own because the reason you're doing it is because you don't feel good. And hormones are really one of the reasons you don't feel good. It's because alcohol is getting your hormones completely screwed up and out of your system, essentially, and is throwing off all your metabolic processes.
This show is brought to you by Bon Charge, and I want to take a minute to tell you about one of their amazing products that I'm absolutely in love with. So, there's something I've been doing for about 10 minutes a day, and it's wearing a face mask. But it's not just any face mask, it's this Bon Charge red light face mask, and it's essential to my nightly skincare routine now. And believe me, red light therapy really works. It's well established in the research to improve the appearance of your skin. And how it does that is it penetrates deep into the skin to boost collagen production. It reduces the size of your pores. It reduces inflammation and it eases the signs of aging. Bon Charge's red light face mask makes it so easy to take care of your skin. It's kind of like a mini spa session every night that I'm doing. It can be used easily at home. There's no cord, so you can wear it while you're doing other tasks. Plus, the mask is totally painless and it doesn't heat up, unlike some other beauty anti-aging treatments. Bon Charge's red light face mask has been a game changer and it's part of my everyday skincare routine now. And I'm seeing such great results already from using this mask. My skin is more clear, it seems more plump and fresh and juicy, and my redness and dark blemishes are fading. So there's a very special offer for all of my listeners. Right now, my listeners get 15% off when you order from boncharge.com and use my promo code Wendy at checkout. So this discount applies site-wide. So that's BONCHARGE.com. And you'll also get free shipping and a 12-month warranty. So go now to get this exclusive offer. That's boncharge.com. And with promo code Wendy, you get 15% off. This is one of my secrets to super healthy, young looking skin. I'm trying to reverse the clock. I'm trying to do everything I can to anti-age. And this is one of the secrets in my toolkit. Yes. Yeah. And so what hormones specifically are thrown off by alcohol?
All of them. All of them. We're talking about estrogen, progesterone, testosterone, which are the primary gonadal hormones, like, made by our ovaries and adrenal glands. And there are the adrenals, and you have adrenal hormones. And then you have thyroid hormones. Then you have the hormones in your brain, which are really crucial. And you have, like depression is one of the huge side effects of drinking alcohol. So dopamine, like if you're not exercising, you lose hormones at that point, but alcohol is even worse because alcohol is really getting rid of your hormones. It's just pushing them right out.
Yeah, and the reason I asked that question is because I know for beer, so to speak, the hops are very estrogenic. And that's
Mm.
why a lot of men, they drink a lot of beer, they'll grow man boobs and they'll get a belly. They get this kind of estrogenic layer of fat on them because it's essentially uh, feeding them estrogen. So the guys out there that are drinking lots of beer, women too, you're feeding yourself these estrogens, which are counteracting your testosterone.
Yeah, if you think about it, hormones are made primarily in the gut, but the whole hormonal axis that comes from your brain and from your pituitary gland, right, the main gland, and it goes down all the way to your ovaries, to the end organs, as we call them, right? And every time you drink, starting with your hypothalamus, alcohol will affect how your hormone is processed and how it's being used by your body. So you have to really keep that in mind and be cognizant of the fact, like your thyroid, for instance. Alcohol will change your thyroid levels, right? It will affect the thyroid levels and will often cause hypothyroidism, meaning low thyroid. Now, the interesting thing is that, you know, we're now a lot more knowledgeable and we work more with estrogen, progesterone, testosterone, but we don't pay as much attention to the thyroid. And the interesting thing is that most people need thyroid when they start getting to their 40s because alcohol being one of the causes, Alcohol literally drops your thyroid levels. And without your thyroid, you start gaining weight, like what you were saying about the guys, right? They just start gaining weight, you become sluggish, you have fatigue, you don't sleep well. So there's so many hormones that are directly affected by alcohol.
Yeah. And so how does her body metabolize alcohol exactly? Like how long does it take?
So it depends, right? It should get rid of it within 8 hours. I mean, but it doesn't. So it depends on the age, right? When you're young, you get rid of everything very quickly because you detoxify so quickly, right? Because your liver is clean and knows what to do. So within 8 hours or so, you should have gotten rid of the alcohol. Now, it depends how much alcohol you drank and how old you are. So as you get older, you can't detoxify as fast. So the same glass of wine, let's say, that you drank when you were 20 and didn't put a dent in anything will give you a hangover when you're 45. And your body will not be able to detoxify it. So within 2 weeks of not drinking any alcohol, things should go back to normal, meaning pre-alcohol level. But again, the data on it is very ambiguous and ambivalent because there is data that says, yeah, we can turn back the clock and be fine if you stop drinking. But the truth is the damage is already done. And when the damage is already done, it's not going to take you right back to where you were. And as you get older, now I work on longevity and balancing all the pieces to make sure that each and every one of us that I take care of feels optimal, regardless of what the chronological age is. But as you get older, and if you've been drinking your whole life, what's going to happen is your liver is already, like we were saying, fatty liver. You already have it. So to clean it up is going to take me and you a lot more time than it would when you were younger. So the earlier, like what you said before, the earlier you start changing your diet, cutting back on alcohol, balancing your hormones, exercising, sleeping regularly, the earlier you do it, the more likely you are to enjoy your life and then become the source of wisdom that we all are as we get older, rather than basically lose your mind and not be useful anymore.
Yes, yeah, and I think people have to understand, every organ has a biological life. There's has only so many years in it that it's going to be functioning correctly, and our livers do 500 plus functions, and there's 100 million people in the U.S. alone that have non-alcoholic fatty liver disease.
Right.
100 million people, so you're already behind. 1 in 3 people, roughly, in the U.S. are behind the 8 ball as it is when it comes to liver function. The drinking will compromise that even more, and it contributes to it, of course. And so, what my point that I'm getting at is that if you're adding fuel to the fire to reduce your liver function, and that's going to have a huge repercussion in the foundation of your health, a negative effect.
You're right. And like, let's take testosterone, for instance, right? So testosterone, alcohol brings down testosterone levels. We see it a lot in men because you see the men coming in with low testosterone in their 40s and 50s, right? And 60s and so on. So it brings down, so if they're drinking, their testosterone level is going to be even lower. And the low testosterone level will take you to heart disease, will take you to bone problems, right? So I see people, and this is like lack of knowledge, really, because nobody's doing this intentionally. And the doctors also have no knowledge that your bone metabolism is directly affected by alcohol, right? Because if your testosterone is low, your bone density goes down. So we're going to give you a shot once a month or medication to fix your bones, when in fact, all we have to do is stop drinking alcohol and tell them to start building muscle. So there's like something off in the way we think, because we're just saying, okay, well, let me get this fixed. And we look at the bone, you know, I chose bone as an example because it just came to mind. But if we realize that everything's connected to everything else, then maybe we stop being, we start taking responsibility for the outcome. And by taking responsibility for the outcome, we can improve the outcome.
Yeah, and I think also people, and when I go back to the conversation I had about the biological life of the liver, when you are taking, Tylenol, when you're drinking a lot, you are shortening the life of your liver. And I don't think people realize when say they're drinking every day, they have a few glasses of wine a day and don't think of it. Maybe they're Italian or Argentinian or they're whatever. It's just part of their culture or what have you. People do have liver failure. They have I've known several people who have died from liver failure in their 50s. And it's was from drinking.
Yeah.
And they just didn't realize the consequence of doing that because you don't think it's going to happen to you. You don't, and that's someone that died from it, not even to mention how people's livers are, genuinely deeply compromised just from that daily habit of having that alcohol, and they don't realize what it's doing to their bodies.
Right. And you know what's so interesting, Wendy, which I find really, and because you live in that space, is that the conventional medical world doesn't say anything about it, right? I mean, they need to have like the Surgeon General put a black box warning on alcohol to say that it increases the risk of certain cancers. We know people are dying, like you said. I was going to say even 40-year-olds we have who've died from liver failure because everybody has their own genetic makeup, everybody has their own response to toxins, everybody's different, right? So we know. I remember working in hospitals when I was in my training and then running the trauma center and seeing 30 and 40-year-olds in liver failure. And that was because they were alcoholics and they drank every day. Now, nobody said, okay, you stop drinking and we'll help put things back together. It was always either too late or they would find some pill or something, or liver transplant or something else instead of actually helping people understand what their own contribution to their own demise was.
Yeah, so if someone is concerned about this or they're concerned about liver cirrhosis, which is the beginning stages of liver disease, so what can someone do if they want to go to their doctor and get some tests done to see if they have liver cirrhosis? If they've been
Like,
drinking and they're concerned about it.
well, if they're drinking, they should think about stopping drinking, definitely. But I think going to any primary care doctor and having just your metabolic panel done, blood tests, will show you what your liver function tests look like. The same way as now, let's go back to hormones since we wanted to talk about hormones, right? The same way as doing a hormone panel will tell us where we are hormonally. But there's a caveat here. The liver function test will, the general metabolic panel will show you what the liver function tests look like. But the hormone panel may not. Depends when you have it done. Depends how old you are. By when, I mean when during your menstrual cycle. And also, if you're on birth control pills, your hormone levels are the same levels of a menopausal woman. And I think that that's an important thing for women to know that, you know, birth control pills are dangerous because they put us in a state of menopause when we're in our 20s. And the problem with that is that with menopause come a lot of other problems. Like we were talking about bones, right? Your bones start falling apart. You get osteoporosis, osteopenia, you get all these issues. And you need to know that because just having your blood tests done to see where your hormones are, you have to look at what you're doing in your life to understand what's going on with your hormones.
I want to take a minute to give a shout out to one of our sponsors, True Energy Skincare. So they have an amazing serum that I am cuckoo about. I've been using their facial serum here for well over a year for a reason. This is just bar none my favorite product, and it's very, very light. It's just a serum you'll put on under your moisturizer. And the reason I use it is because it's a frequency-based skincare. So they have frequencies imprinted on this serum that improve collagen, improve elastin. Collagen is that support matrix in your skin that makes it look firm and juicy. And we lose that as we age. That accelerates rapidly after we hit menopause. You lose 30% of your collagen within 2 years after menopause. So I'm using everything I can get to improve collagen. And this has over 2,000 frequencies imprinted on it, and that are for skin nutrition to help the appearance of your skin, the fine lines, the age spots, and it will smooth out the texture of your skin as well. And this has been my secret weapon that I've been using to improve my skin, look and feel and health for, like I said, for well over a year. And so I'm not promoting this because they're a podcast sponsor. I'm promoting this because this is one of my secret weapons. I love this product and I use it every single night under my moisturizer. And this has no toxic ingredients in it whatsoever. And it has lots of nutritive ingredients as well. It's got fruit enzyme extracts. It's got oat kernel extract. It's got oat beta glucans. It's got beech bud extract, and it's got algae and chlorella in it as well. So lots of great nutrition in this, as well as the frequency enhanced aspects of it, because any old product can moisturize your skin. That doesn't impress me. But the results you get from this are bar none, and that is why I highly recommend it. They have a very good offer for my listeners. Go to trytrueenergy.com/Wendy. That's trytruenergy.com/Wendy, and get a very, very special deal for my listeners. Yeah, that's affecting those hormone levels because
Right,
there's
right.
also, issues with a lot of toxins that are very estrogenic that we're all exposed to every day and that wreak havoc on your hormones as well. But at least with alcohol, it's very controllable. And so, can you
It
talk
should be.
about, yeah, well, we'd like to
It
think that.
should be.
Yeah. And
Right.
so what amount of alcohol is reasonable to consume? Because there's been, like in the 2000s, you'd always hear like, oh, one glass of wine is very healthy
Right.
for you. And I'd always had that in the back of my mind, like, oh, this glass of wine, not a big deal because it's actually healthy. I'm getting that resveratrol and those
Right.
antioxidants, and oh, this is
Right.
healthy. So
Right.
that study has been retracted. That study has had no merit and actually showed that the alcohol was causing harm. So can you explain that a little bit or expand on that?
Sure. Sure. So this is a funny thing that resveratrol has been connected with improving, it's an anti-inflammatory, antioxidant. It helps. And if you drink a few gallons of wine, you may get resveratrol a day. You may get enough resveratrol to help you. Also, the data on resveratrol is kind of weak anyway. We don't even know that resveratrol really helps, with inflammation and immune boosting, etc. But the interesting thing is that the studies were probably most likely studies that were sponsored by the industry. So why would you trust them? The truth is that no amount of alcohol is good. No amount of alcohol. I'm sorry to say that. It breaks my heart to say it because we're
It
such a
breaks my
culture.
heart too.
You know why? Because we're such a culture, we think that drinking together brings us together, that it makes us connect with each other. It has a lot of cultural value that's associated with it. But the truth is, there is no value to our bodies. It's toxic. So one glass is bad enough. Now, the interesting thing is that when I say that, as I said to you before, is like people will say to me, oh, you're the temperance society. But I'm not. I mean, I'm all about being reasonable and common sense, right? So you have to put it into perspective. When you're young, I mean, having a glass of wine at a party probably is just fine, or maybe 2 glasses. Blacking out is not fine, ever, at any age. Doing 10 shots of tequila is never okay. So it's about moderation and about accepting the reality that when you're young, you can do it. But when you get over 40, you're best off stopping. And if you stop, your body will be able to detoxify your liver, clean up the rest of it, maintain your hormone balance. So when your hormones start actually really leaving you, you are able to have them rebalanced correctly by the right practitioner, obviously, but things can come back to normal. So if you can stop drinking when you're in your 40s, you're going to do really well for yourself because you can actually guarantee that your longevity will increase. Your amount of time that you spend healthy will increase. Your need to have, a hip replacement or getting diabetes or getting obese or getting sick decreases literally at the same time as you stop drinking.
Yeah, and I think people need to be aware listening to this show about learning how to detox. Well, when you have that glass of wine every night or that beer every night, that's a, 911 3 alarm fire your body and your liver has to deal with. Detoxing is not happening. It's just focusing on that alcohol or the industrial seed oils that you had for dinner. You're putting detoxification on the back seat, on the back burner. So that's not happening if you're drinking day after day after day. And not to mention that you're going to compromise sleep. And let's talk about that for a minute, because I think people don't realize the negative impact they have on their sleep. And that's a huge one because that's the foundation of your health. That's the foundation of detoxification that's happening mainly at night as well.
Exactly. That's actually a really important topic. As you get older, you don't sleep well. As you lose your hormones, right? Perimenopause, menopause, you can't sleep anymore. And it's actually your pituitary gland's way of sending messages down the pipe saying, make more hormones, and your ovaries are not making estrogen, they're not making testosterone, and that's why you can't sleep. That's what makes you, it pushes up the cortisol level and you can't sleep. But this is the thing. People think, and this is again cultural, that drinking alcohol or drinking helps us relax and helps us sleep. And that's a complete fallacy. It may help you pass out and you'll
Oh, it,
sleep
it
for
does a good job of that. That's a great job.
right? Right? You'll pass out for 2 hours, but then you'll wake up and it'll be worse because the cortisol level has been up because now your body's trying to deal with the alcohol that you put in there. And you will have, your palpitations, you'll get anxiety attacks, you won't be sleeping well. So the quality of your sleep is dramatically impacted and negatively by alcohol.
Yeah.
And as it's removing your hormones that you need.
That you need to sleep. Yeah, and I track my sleep with an Aura ring, and if I have a glass of alcohol, my sleep goes out the window. I don't get as much deep sleep. I don't get as much REM sleep. It's always negatively impacted. And I've just done some experiments with many things that help sleep, and I want to look at things that negatively impact sleep as well. And I think alcohol is also, it affects your blood sugar. So you drink that alcohol, it's going to raise your blood sugar. At some point it's going to crash. You get that cortisol coming up, and then that's what wakes you up. So forget weight loss if you're drinking.
Oh, no.
Not going to happen. You're not going to sleep. I mean, there's just so many other factors involved here.
No, I think what you're saying, Wendy, is really important about what happens as far as the cortisol level going up, but also alcohol happens to be sugar. Nobody seems to get that. right? They say, oh,
It's
it's
pure
I
sugar,
am on
liquid sugar.
right, right. That people will say, I'm on a low carb diet and I don't eat any carbohydrates, but I have 3 glasses of wine a night. What do you think the wine is? The wine is sugar. Alcohol is carbohydrate. It's sugar, like you said, pure liquid sugar. So what it does is it goes right into your bloodstream because obviously it's easy because it's liquid, right? Forget about you being knocked out. What happens is your blood sugar level goes up, your insulin level spikes. And when your insulin level spikes, because it's trying to bring down the sugar level that the alcohol has given you, the sugar rush, right? As the insulin goes up, you're getting into a lot of trouble because that starts a whole cascade of hormones that should not be there at 2 o'clock in the morning. Like you said, the cortisol, the adrenal hormones, all the hormones that should be going to sleep and being renewed and remade in the middle of the night are not. They're being actually demolished by the spike in insulin that the sugar that alcohol is creates in your body.
Yeah, and I presume that alcohol helps to make more GABA, and that's why people like it. GABA is the hormone that is relaxing, and it's part of the reason why people like it. Can you talk a little bit about that?
Yeah, well, we know about GABA, which is gamma-aminobutyric acid. You also know about dopamine, serotonin, all the feel-good hormones that are made in our amygdala, that are made in our hypothalamus, pituitary, oxytocin, which is made in the posterior pituitary, which is just like the closeness and warmth and feeling connected that you actually get when you close to someone, when you're petting your dog or having sex with somebody you really love or your child, that's when you release all these hormones. Well, all of that goes out the window the moment alcohol comes into the picture because while initially because of the sugar, right? It the levels may go up, they will drop a lot faster and they will actually create more toxicity, and you know about that more than anyone else because it'll go right into your liver and create all these toxic byproducts that your liver will then have to sit there and get rid of it while those hormones that we need so badly are not being made.
Mhm. Are there other things we can do to relax? I know that a lot of people have a habit of having that glass of wine or that beer when they get home at the end of the night. What are some better habits that people can employ to relax and sleep?
I think that's such a very good question because, again, it goes to our culture being so, if you think about it, 20 years ago, if anybody said anything about what I'm about to say, people would have said, "What?" Meditation, breathing, helping people relax and focus on themselves. And that's something that we never focus on because if you take care of yourself, your body's not gonna crave the alcohol. Because 'cause you're right, drinking is a habit. Drinking is not necessarily that we're all alcoholics. It's just a habit. It's something that you do because everybody else is doing it, not because you need it. So what happens is that if you create other habits, you can get rid of the habit of drinking alcohol. So breathing to me is a really important thing to do because we don't breathe. None of us breathe. Breathing is kind of a Eastern way of looking at things, and Americans never breathe. So now we're starting to breathe. Breathing will rebalance and move us from being in a sympathetic mode all the time, meaning like in fight or flight all the time, right? Releasing cortisol, making our bodies like go crazy all the time into parasympathetic, which is calm, which is what we're seeking when we're drinking that glass of wine. But we're seeking it erroneously because it's not going to really help us, because it'll just create a cascade of bad stuff going on. So breathing is a very important way. The other thing is meditation. And, when you say to people meditation, to this day, I have patients. I mean, and I am blessed to have a really great group of patients who are very evolved and they're working very hard at keeping their health and focusing on optimizing their health. But sometimes when I say meditation, they'll be like, what? I can't meditate. I can't. So instead of saying meditation, one thing I say is just sit there, sitting alone without a glass of wine, sitting alone and just breathing. And like, if you could go for a walk in nature, it's beautiful. If you live where we live, it's the middle of Alaska, basically. It's so cold here. You can't do it now. But being in a calm space, creating a calm space, because that's what the habit of alcohol is really trying to create. So that's why we're trying to create that. And alcohol is not going to do it. But trying to relax, stretching, people over exercise. That's another thing that happens more and more. That people say, okay, I'm going to exercise. I'm not going to drink. I'm now going to exercise. But then they over exercise. And over exercising does pretty much not a lot of good, because as you get older, you'll get injured. And injury is like the death of us, because injury is the worst thing you want, the last thing you want. So walking, sitting, relaxing without alcohol, increasing the amount of water you drink. Instead of getting a glass of alcohol, why not get a glass of water? And then not eating and drinking at the same time. I think that that's one important thing that somehow we don't focus on, which is if you don't drink while you're eating, your body will have more digestive enzymes to process the food, will help your liver detoxify things better, will help your whole system from bloating and getting all kinds of unnecessary side effects. And it's going to stop you from drinking alcohol.
So this episode is brought to you by Chef's Foundry. They've got a fantastic line of cookware called P600. It's totally non-toxic. I think people don't realize that when they're cooking, most people's cookware is adding toxins to their healthy food, that people spend so much money on healthy organic food and then cook it in toxic cookware. And so that includes cast iron, which I do not recommend. It adds way too much iron in a form that we can't absorb. People use aluminum cookware, which is very inexpensive, and it's used at most restaurants, giving us tons of aluminum. People are also using ceramic cookware, which can leach toxins into your food. And not to mention the nonstick cookware. It just has so many PFAS or PFAS that is so toxic. It's one of the forever chemicals. So you really have to pay attention to what you're cooking in. So that's why I recommend the P600 line by Chef's Foundry, so that you can have peace of mind when you're cooking and you're not getting any nasty chemicals like lead or cadmium or nickel or PFAS in your healthy food. You can get a special discount for my listeners by going to bit.ly/Myers Detox. So that's bit.ly/Myers Detox, MYERS DETOX, to get an exclusive discount just for my listeners. I want you to be thinking about what you're cooking your food in, and I highly recommend the P600 line by Chef's Foundry. Yeah, and I think it's important also to work on emotional trauma, doing that bioenergetically, or doing EMDR, any kind of
Totally.
bioenergetic type of modality, because that's the root cause of a lot of people's drinking and addictions. And also I really like supplementing with GABA. I think that's really important. I think because we live in such stressful environments, that we use up a lot of our GABA, that's kind of the brakes for the more excitatory neurotransmitters. So I really like the form phenyl GABA. You don't find that very often. That's the kind that works really, really well. That's really key to facilitate sleep and relaxation.
I couldn't agree more. And I think that it's really important. Um, to realize, like, when you're talking about diet and how you're eating, and making, eating a family affair. Sitting down at the table and eating and cooking at home instead of getting all the junk that we buy outside. Because that helps not just for us to feel better, but it helps the connection. And when you talked about trauma, which I couldn't agree with you more. I think we're all suffering with intergenerational trauma. We're all suffering with so much that we're carrying. I think COVID just kind of started exposing it, and we started paying attention to a little bit. But it's people like you and me, and there are not too many of us really, who are seeing it. I mean, I have a lot of patients, as I said to you, who are very, very evolved and very smart, and they'll go and they'll do the mushrooms and the ketamine, and they'll do all kinds of EMDR and all kinds of therapies to help them deal with this intergenerational trauma. And I think it's really important that you need to deal with that, but not everybody can afford it, and not everybody even knows that it exists. But if you stop for a second, like I said, and just sit there alone, like journaling or, doing anything that focuses you inward, you'll actually help yourself. You don't really need the outside world to help you. And I think, part of this trauma that we're all suffering from is also helping us deal with forgiveness, with being peaceful, being able to support the other person and not being judgmental and thinking like, oh, this person's behaving poorly because they're bad. You don't really know what's going on in anybody else's mind, but you can focus on what's going on in your mind and forgive yourself and be kind to yourself and break the intergenerational trauma cord that you have gotten from your parents, your grandparents, etc. So there's a lot. And when you're talking about GABA and other supplements, let me go back for 1 second to hormones, since we're moving completely out of there. Let me also say something else. When your hormones are in balance, everything else works. And we can make I shouldn't say everything else works. When your hormones are in balance, you have the foundation to make everything work. So that doesn't mean that hormones are the only solution. The hormones are the foundation. Once you have the foundation, then you should really address everything else, from intergenerational trauma to your diet, to your supplements, to exercise, to stress management, to sleep, to everything else. And the more pieces you address, the more likely you are to create a full picture of what works for you. And I think that's really probably the most important message about hormones.
Yeah.
Because supplements, as far as I'm concerned, I started using supplements about 20 years ago. And being a conventionally trained doctor, I was told, everybody said, oh, supplements, they're like crazy. These people are nuts. Why would they use supplements? Because, look, they affect every part of your body. That's crazy. So it took me literally 2 or 3 years to understand that not only was that not crazy, but every drug we give people affects every part of our body, only it's called the side effect. So it was so stupid. So I've been working with supplements, and I think supplements are really crucial and critical to putting together the right picture, helping people like detoxify, balance hormones. There are a lot of very important pieces to the supplements, and you're the expert at supplements, and we know that. And I think it's so important to understand, because back to that, alcohol depletes your vitamins, your vitamin A, your vitamin D, your vitamin K, your vitamin Bs. They're all depleted. B1, 2, 3, 6. They're all depleted when you're drinking. So that's
Yeah.
crucial.
Yeah,
As we
depletes zinc too, which you need to make
everything.
testosterone.
Totally, and magnesium, it depletes really pretty much everything. And we don't even know because there's no research there to show you how terribly destructive they are. So you're right, totally right. I agree, couldn't agree more.
Yeah, and so I wanted to talk about one reason why some people might want to drink is there's the lack of progesterone. And so when women, we get in our late 30s, 40s, that progesterone really takes a nosedive, and you're going to feel more stressed. You're going to have a lower tolerance for stress, harder time calming down. You're going to have trouble sleeping. And I spent my whole 40s looking for sleep solutions. I took every supplement, I was doing all kinds of stuff, and I just had a lack of progesterone. And that was all, that's, for the most part, what it was. And that's why I say I wish I would have started testing earlier. I always thought, oh, that's a menopause thing. The low hormones is for women in menopause. But, and there's
Mm,
there's so many things working against our hormones today, including toxins and all the
right.
things that we talk about on the show. But can you talk about progesterone and replacement of that? Because I think I started taking progesterone creams, and which is only give you like 5 or 10 milligrams, and I would take that, and I thought, oh, it's not really doing. I don't really feel much different. I'm taking 600 milligrams of progesterone every
I'm
night. This
I'm
is like,
so there, exactly.
yeah,
So the amount you take is what's right for you, which means you have to figure it out with somebody who actually cares about you. And clearly, but I give progesterone to teenagers when they have PMS. We give them progesterone and they feel better. And so progesterone stays with us for our entire reproductive life, right? So progesterone is the hormone that we make after we ovulate. So every month, for half the month, we have progesterone. If we get pregnant, we make even more progesterone. If we're not pregnant, we get rid of the estrogen and progesterone and get our periods. But progesterone is a wonderful, wonderful hormone. It balances out the effects of estrogen, testosterone, cortisol, everything else. But the beauty of it is that we have access to it and it's been around. They have FDA approved, they have compounded. There are a million ways you can get progesterone. But if you look at the science behind it, progesterone gets absorbed the best in injectable form, which I would never recommend to anybody because why would you take shots, right? If you have to. The second way to get it in is you can put it in your vagina and it gets absorbed. And by the way, anything you put in your vagina really gets absorbed systemically because there's blood flow and everything's connected. So when your doctor says, I'm going to give you something that is only local for your vagina, they're out of their minds because it's not true. It goes everywhere, right? So progesterone, intravaginally gets absorbed. Orally is the next thing. And the creams are the least absorbable, but they still get absorbed. So you have to figure out what works best for you and then take it. I work in particular with a compounded form, and it's very easy to find a compounder to do it with you. A compounded form of slow release, which releases the progesterone over the course of the night. So it keeps you asleep so you don't wake up like at 3 o'clock in the morning. And then you figure this out on your own, literally, if you're taking it earlier or later in the evening, and the results are really magnificent. So I think progesterone is really crucial. And everybody, we don't talk about it enough. And you go and get it at the drugstore, and then there are a lot of formulations that you really need someone who knows the formulation that will work for you and knows how to try various formulations to get you the right formulation.
yeah, yeah. I think it's really important to get it from a compounding pharmacy, and there's like the synthetic progesterones out there that you might get if you get a prescription from a doctor that doesn't necessarily, they're not really focused on hormones or just kind of thinking conventionally and giving you the Premarin or what have you.
So you know what? Don't go to those doctors. If your doctor starts telling you, tell them bioidentical hormones. They used to be called natural before they were called bioidentical because they are natural. Um, that's what you want. And if the doctor starts writing you for birth control pills or starts writing you for Premarin or Provera or Norgestrel or whatever, any kind of non-progesterone or estradiol, just say goodbye and find somebody. There are a lot of people nowadays who really know how to work with bioidentical hormones. So please don't use anything else
Yeah,
because
that was my first foray, and I went to a doctor that said that they do bioidentical hormones, but when I went to the pharmacy that they gave me Premarin.
perfect.
They gave me,
Why? But you know why? Because the insurance companies will substitute because there is progesterone and estradiol that is FDA approved and they're bioidentical formulations, right? But the pharmacies will substitute with non-human identical, like pregnant horse's urine, Premarin. They will substitute it because that's what the insurance pays for. So be careful. Make sure you're careful and you know what you're doing and you work with a provider who knows what they're doing too.
and yeah, I didn't realize that the pharmacy might substitute that. You got to be very, very careful because they're not making that discernment.
Yep.
So yeah, and that's why it's really important to get it from a doctor who's working with a compounding pharmacy to get that actual real bioidentical hormone.
Yeah, or there are like estradiol, estrogel, Divigel, the patches that are FDA approved that are the right thing. Then you have the progesterone. In Europe, it's called Utrogestan, which has been around for a lot longer than we've been around, but it is progesterone. Make sure it says progesterone, micronized progesterone. And if that's not what it says, you don't want it.
Okay, great. Fantastic. Yeah, and I think it's so important to, like I mentioned before, testing early and just, even if it's just for a baseline, just see where you're at. If you're in your late 30s, you're in your 40s, or certainly in menopause. I don't advise doing menopause without hormones. There's a
Me
lot of
neither.
there's a lot of problems women have. Like I started finding that I was pulling muscles. I'd go on a walk and I
Sure.
would pull a muscle in my butt.
Yeah.
This is like a year or two after I had gotten into menopause. And
Yeah.
every time I go to the gym, I would injure myself. And I'm like, what is going on? And it was just a lack of estrogen. You start
Exactly.
having a lot of musculoskeletal issues and
Yeah,
pulling muscles easy because of lack of estrogen, and replacing estrogen and taking BPC 157 peptides has helped
right.
to stop that problem so I can live my life and go to the gym.
And look the way you do. You look
Yes.
like you're 35 years old. But this is the thing, and we work with peptides and I teach in the peptide courses at A4M too. And peptides are amazing. And we need to realize that some of the hormones are peptides, oxytocin, insulin, they're peptides. And so you want to make sure, like you said, the BPC 157, which is an amazing peptide, work to put them together. Put things together. As I said, the more pieces to the puzzle, the more likely you are to come up with a great result.
Yeah, and so let's talk about you mentioned some health issues related to drinking alcohol. Can you give us like a little bit more, like some other health issues related to alcohol consumption? Because I had like a friend of mine who was 49 years old. I've known him since my teens, and he was a sommelier. So he sold wines to restaurants. The guy was a picture of health. He worked out 2 hours a day. He was in all respects very healthy, ate amazing. He died of colon cancer at 49. And it was just all that alcohol that he was sampling and trying and becoming an expert in. And certainly there are other factors involved too. But yeah, I just think there's a lot of different many different health issues that can come with drinking a lot of alcohol. So what are those?
Everything. Alzheimer's disease, if you keep in mind what you said, which is exactly the way to look at it, is alcohol is pure liquid sugar. So once it gets into your system, what it will do is wreak the havoc that you're trying to avoid by not eating a lot of bread and not eating junk, really. So I had a patient actually who died in her 50s because, as far as I'm concerned, she was on hormones, she was doing really well. It turns out that every night she would eat like a whole like box of candy and have like a couple of glasses or 5 glasses of cognac or something like that, which is like a really heavy duty alcohol. So that's why she died. She died because she was doing, she was doing herself a disservice by not realizing that, taking hormones and exercising and doing everything else was not enough. So what diseases that alcohol will cause? Every disease you can think of, starting with obesity, that, our country, 43% of our country is obese, and that should be on everybody's diagnosis. It should be that they are obese because they're the root cause of diabetes, hypertension, arthritis, um, Alzheimer's, dementia. All the problems are cardiovascular disease. And then you look at the cancers and how the whole thing started with alcohol, about the black box warning that there's 7 kinds of cancer, starting from thyroid and the tongue and liver and pancreas and colon and ovarian, and all of these cancers that are directly related, connected. The risk is increased with the drinking of alcohol. So I don't know how much more we need to pay attention to realize that we can protect ourselves and should be able to protect ourselves by getting rid of alcohol.
So for anyone listening that really wants to detox their body, go to heavymetalsquiz.com. I created a quiz for you. It only takes a couple of seconds. Based on some lifestyle questions, you can get your toxicity score and get a free video series that answers all of your frequently asked questions about how to detox your body. Check it out, heavymetalsquiz.com. Yeah, when I saw that study come out, it really kind of hit home. And I just decided, you know what? I just don't need alcohol anymore. I don't even really like it that much. I've never been a big drinker, but I was having, a glass of wine here and there, maybe every week or two. And I was like, you know what? I can live without that. And about 2 or 3 months ago, I'm like, I'm done. I don't want any more alcohol. It affects my sleep, and there's no benefit whatsoever. There's no benefit that's worth all these other factors that we talked about. I just don't need it in my life. I don't want it. I'll have it maybe occasionally if I go out to dinner or something like that.
Just fine. I
Yeah.
mean, listen, New Year's Eve, get a glass of champagne, by all means. You're going to a wedding, or to some celebration, have a glass of something, but don't have something every day.
Yeah.
Don't destroy what you're putting so much effort into, which is your health, because you're destroying it with alcohol.
Yes. Well, Dr. Schwartz, thanks so much for coming on the show. That was really, really good. And I love tying the hormones into alcohol, because I think a lot of people don't realize how they're destroying their hormones and undermining their health in many, many different ways with, just trying to relax at the end of the night. So why don't you tell us about your clinic, how people can work with you and whatnot?
Well, you can find me on Instagram at DRERIK Schwartz, Dr. Erika Schwartz on Instagram. The clinic is ES Health, Evolve Science. So you can find that on Instagram too. And just email us, call us. We do a lot of telemedicine. So we take care of our patients and we love them and we really show care. And it's all about caring, really. At the end of the day, if you have a provider who cares about you, you'll thrive.
Yeah, great. So eshealth.com. So Erica, thanks so much for coming on the show. And everyone, I'm Dr. Wendy Myers. Thanks for tuning in every week to the Myers Detox podcast. And I love bringing all these experts on to really help you make those distinctions that you need to make so you can make better health decisions for yourself so that you can live that long, healthy life that you deserve. So thanks for tuning in. God bless.
The Myers Detox podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.